Welcome back, everyone, to another new episode of Grow Your Path to Wellness. Last episodes were releasing bi-weekly. So our last episode, we had the pleasure of welcoming a fellow mental health TikTok creator, Jessica Raybon. She says Robin Raban, covering the topic of self-compassion and eating disorders. So if you missed that, make sure you go back, tune in. We covered a good bit on kind of an overview of different eating disorders down to the difference between eating disorders and disordered eating. It's a really, really good episode. This week, we are excited to welcome one of Amanda's connections, Dr. Julie Pyle. She's going to be sharing her experience using acupuncture treatment for mental health. Welcome, Dr. Julie. I hope that's okay if I call you Dr. Julie. He's your first name, but thank you for being with us.
Thank you for having me.
All right, so let's jump right into it. I'm so excited to have you here. Can you just share a little bit about yourself, your career, your experience, and why this topic of acupuncture and mental health today?
Yeah, thank you. So I'm Dr. Julie Pyle. I am a chiropractor and an acupuncturist, and I have a wellness clinic where we also offer massage and Reiki as well. So I've been doing acupuncture for over 10 years now, and I've just seen huge benefits with acupuncture and different mental health disorders in conjunction with other treatments as well. So yeah, I'm so excited that we're here to talk about it today.
I was so excited for today because this is something I've never done acupuncture myself, and I probably make an excuse because they're all like super far from my area, like practitioners, but I'm super excited to learn more about it today, especially being a therapist, but also just a human who's been very intrigued by it. So so if we kind of jump right in for our listeners, do you mind kind of sharing how acupuncture can help with mental health disorders, like the big ones we hear about very often: anxiety, depression, overall stress, especially nowadays. But how can that help those types of things overall?
Yeah, so there's two sides of acupuncture. So acupuncture has been around for over 3,000 years. So it's been around a long time. So you have the ancient holistic side of it, and then you have the modern science side of it, how it actually works. So the ancient side of it is, we believe there is over 12 energy meridians or channels that run through your body. If anything's blocking the energy flow, your body's just not going to feel as good as it could. It's not going to function as well. So the acupuncture just helps to clear the energy channel so that your body can function the best it can with what it has. So the modern side of it is the acupuncture causes the release of different chemicals in your body that just calm down your nervous system, that just make your body more balanced chemically. So with the different mental health disorders, there's a lot of times there's a chemical imbalance, right? So the acupuncture helps to balance out those chemicals so that you can manage your anxiety better, so that hopefully someone doesn't feel as depressed, because now your body's releasing those feel-good chemicals naturally with the acupuncture. So, does that make sense?
It does. And for those, so we do, when we're talking about acupuncture, for somebody who's not heard about it ever, what does a typical session look like? I don't know if that's an answerable question or if that's too vague. Some people know that you use like the little needles and things, but can you walk somebody through like maybe what to expect a first session?
Yeah, absolutely. So usually the first session, I'll sit down about 10-15 minutes, talk to someone, get their medical history, why they're here, what they want to focus on with the acupuncture, and then we dive right into it. So a lot of people are very hesitant to try acupuncture because it does involve needles. So sometimes it gives someone a long time until they actually try it. But we do use needles and specific acupuncture points throughout the body that help with whatever we're trying to work on. The needles are very thin, so as thin as 2 pieces of hair. So you barely feel it. So with the needle insertion, you might just feel a little pinch, a little pressure, and then that's it. A lot of them you barely feel. And then once they're in, most people just feel relaxed. They kind of are aware that the needles are there, but it doesn't hurt at all. So it ends up being very relaxing once you get used to it about 10, 15 minutes in. And then you lay there with the needles, let the needles do their thing for about 20, 30 minutes. And then afterwards, hopefully feel calmer, more relaxed, better able to manage everyday life.
I so appreciate the way you described, because so obviously I'm a patient of acupuncture and I thoroughly enjoy it, but the way you just described it, and I refer people too, like, if I think it's helpful with their mental health, maybe try this. But the way you described the like ancient medicine part of it and then the modern was so helpful. And I think that like we talk often on here about the woo-woo science, or like, people are like, oh, that's too woo-woo for me, or too hippy-dippy, right? But if you can say, hey, yes, there's those roots in the ancient medicine, but there's also current scientific data. That's a really great explanation. And then with the acupuncture, yeah, I don't like needles either. And I will say for me personally, the more often I go, the less I'm bothered by them, like the better I'm regulated, or like, I don't know if that makes sense. But when I really need acupuncture for whatever reason, I'm a little more heightened in the sensitivity. So, but yeah, once they're in, it's like, I tell them it's like forced meditation time for me. You just lay there with meditative music and a salt rock lamp and just vibe out. So highly recommend.
Yeah. That's so true. The more you get it done, your body becomes more used to it and acclimated to it. But when your body's in fight or flight mode constantly, your body is going to be more sensitive to it. And so certain points you'll feel more because your body really needs that point that day, because you're just hypersensitive, you're fight or flight, or somebody's super depressed, or whatever it may be for them. You're definitely more sensitive because your body needs it. That's how out of balance your body may be that day. So that's very true.
A point that came to my mind. Oh, sorry, Amanda. Something that came to my mind that I hear a lot, because I go to, and I know you're a doctor of chiropractic medicine, and I go to the chiropractor religiously. And as a therapist in my own kind of area of healthcare, and then I consume other types of healthcare, I think it's important for people to understand that you don't come and do these things one time. Like, it's good to come, please come, especially if you are but people get to like a crisis place, like functioning, but like quote unquote barely for them, and they're typical. And then they come, do it once, and then it's like, oh, well, this person wants me to keep coming back. Like, this is a scam and blah, blah, blah. And I'm like, it's maintenance.
Yeah.
Like, this is something to do. I mean, there's some privilege areas and things to consider being able to do it consistently. But I think what it sounds to me, I've never done acupuncture, but it's another area of healthcare where it's like, I hear you saying, once you do it more and you come back, and then you can notice over time maintaining that level of better functioning, better wellness.
Yeah, exactly. And that's very true. And everybody's different, There's some people that can do maintenance once every couple months. There's some people that need to do maintenance a couple times a month. So everybody's different. So there's no one plan fits all. And some people disappear for 6 months and they come back because they do well. So everybody's body's different. That's the biggest thing that's important to me, is listen to your body. Only you know your body better than anyone else. So only you know how often you need it. But the important thing is to listen to your body when it needs it. And you're exactly right. It's not a one and done. You can't just get one session and boom, magic, you're better. If that was the case, I could charge a lot of money for one session. But yeah, you definitely need to be consistent in the beginning. until you get to the level that you want to be at. And then you can come for maintenance, whatever that may be for you.
This is why Dr. Julie's my people. We say the same things, right? We're like, listen to your body. Only you know.
Yeah,
I don't care what anyone else says. I don't care what their label is or their schooling or education. I don't care. You know your body better than anyone.
exactly.
This, I think, goes really great into our next point. And if anyone knows me or Kelsi or has listened to the podcast before, they know the whole podcast is based on holistic wellness, right? So there's no one right answer. There's no cookie cutter. And it's also not just one thing that we do for our wellness to maintain. Like you were saying, you get to a certain point. However, I'm assuming you're meaning that's not just doing the acupuncture, right? That's other lifestyle changes. So can you talk about what things you recommend in conjunction with acupuncture?
Yeah, there's so many different things we can do for our mental health. So you can't just do acupuncture for a mental health issue or for stress. You have to make other changes. So, that mental health, working with a licensed therapist, a licensed psychologist, working with somebody when you have something mental health going on is so important. Because if you're not getting that mental health therapy, which I don't know a lot about that side of things, you guys can speak on that, but that's why I always say make sure you're talking to a therapist, a counselor, a psychologist in conjunction with your acupuncture. Because if you don't get to the root cause of whatever it is that got you to this point, well, we're kind of just covering the surface of things with it. You're going to feel calmer, but you also have to work on that mental health side of things. Holistically, there's so many things diet-wise. I mean, we could talk a whole hour on diet alone, but just diet-wise, make sure you're not eating a ton of sugar, different things that are not good for your body. Getting outside in nature is so important. Without getting outside daily, that really affects our mental health, especially we're in Ohio. Our winters are not the greatest. We don't get any sunlight, but even just getting outside in the cold air helps with our mental health so much. Diet, exercise, getting out in nature, all of that is so important, and it affects our mental health so much. And you guys can attest to that and probably even give more recommendations than I can, what else somebody can do in conjunction with the acupuncture if they have a mental health issue.
Yeah, I mean, and often it might not even be an actual diagnosis. It might be a symptom, right? It might be sleep or pain or suicide. Like it could just be one symptom, right? And I know you recommend like certain supplements, or you kind of share on your social media, like, hey, did you know that this supplement can help with these things, or inflammation, those kind of things that I thought maybe you might be able to speak on.
Yeah, definitely different supplements. The new big thing is CBD, right? Everybody knows about CBD now. CBD is great for anxiety. You have to talk to a health professional to get the recommendation for good quality, how many milligrams, different things like that. There's also low level THC, medical marijuana is becoming bigger and bigger across the US. So different levels of THC may be helpful for some people, not for all mental health people by all means. Different anti-inflammatory supplements, elderberry, tart cherry are just some things off the top of my head. So there's different anti-inflammatory things you can incorporate into your diet daily. Because when your body's inflamed, it doesn't function well. Okay, and that affects your mental health so much. So those are some of the basic supplements I usually recommend for different people based on what's going on. But there's so much out there, so much. I mean, we could talk a whole hour on what to do with your diet and supplementation to help with your brain health and your mental health.
Yeah, and what you said about making sure you talk to a mental health therapist, even if the root cause might not be something that we need to treat. However, going through trying to figure out what's going on in your body and going to different practitioners or getting different treatments or trying different supplements and like trying to figure that out, just to have somebody to balance that off of and bounce that off of, and that process and the stress of it, and your access to those resources or the supports that you have to help you, I want to get to the gym and work out more, but I would like my partner to, right? Like, do you have someone to go walking with? All of those things, even just to have that mental health professional along the way, just to process working through different treatment options.
Yeah, absolutely. And also maybe to just kind of be a coach and guide you, like, okay, you get really overwhelmed trying to heal from something, right? So it's like you have that mental health coach almost be like, okay, one step at a time. We start here, we do talk therapy. Okay, next week you're going to go to the acupuncturist. And then next month we're going to talk about diet or whatever it may be. So yeah, just kind of having that coach to guide you so you don't get overwhelmed trying to manage whatever it is, anxiety, depression, different things like that.
Yes. I love that Amanda brought that up, because I remember I have new clients come to me and like just misconceptions, which I'm sure with the things that you practice, there's misconceptions. And do people come to me with very in-depth, one of my specialties is a specific type of, trauma. And so that's a thing. It's a very real thing. But also people come to me and it's like, well, we don't always just jump right in and start there. Like, we need to get a very large picture of multiple things that are going on, because in our field we say, humans are walking systems. We have to look at a lot of different dimensions of life. And then when I do a treatment plan with somebody, they're always so kind of caught off guard, but not necessarily in a bad way. But like, they're like, so this is going to involve you helping me find a family doctor, or if they feel like chiropractic's good for them, or acupuncture, or massage therapy, or like, and they're like, oh, like you can see that misconception kind of go away or be challenged a little bit. They're like, holy cow, there's a lot that can go into the things that we work with people on. And it makes my heart so happy whenever other clinicians and different disciplines refer people, like, and then we refer to them, because it's so important. Like, you come to me and yeah, we're going to work on some specific things, but also opening their eyes to all of these other dimensions of their life that could likely, benefit from being addressed.
No, that's so true what you said. The body is a whole system. It's a very complex system. And it's great that all these different practitioners can work together to help somebody. We're all specialists in different fields, and to just have that whole body health is just so important, because the body is so complex. So yeah, exactly.
Now, if we jump into our next point here, it kind of builds off of this one, of course, but the long-term ramifications of using medication for different mental health issues, like from your perspective and your discipline.
Yeah, and that's a tough topic, because I don't specialize in pharmaceuticals. That's not within my scope, but I do see, there's always a time and a place for medication. But long term, if you're on some of these anxiety and depression meds, number one, over time you become immune to it, and so it doesn't work as well. So then doctors are constantly just playing this game where they have to find a new one for the patient, or they up the dosage, and it's just constantly a game trying to figure out the right meds, from what I've seen with my patients. And then long-term medication use, it has an effect on your kidney and your liver. So your organs process these medications. And if you're on some of these medications daily, it can just start to wear down on your different organs. Some people can't survive without the medication who have mental health disorders. But for some people, I have seen it where their doctor has been able to wean them off, or just keep them on a low dose when they are doing other modalities such as acupuncture and massage and getting the therapy. So it's a complex topic, but just long-term, people need to be aware of the long-term effects that it could have on their body, just so they can make that choice. If there's other possibilities for them, then that'll be better for them long-term for their health.
Now, we are social workers by trade, so we always want to address, advocating and marginalized populations and privilege, like Kelsi said. So for somebody because acupuncture, I don't believe, sometimes maybe some insurances, but not often, is acupuncture covered. Is that correct? Yeah. So for somebody that's not able to access acupuncture, how do you feel about like the little sticker, like little pressure? I don't know if you've seen those. I'm sure you have. And then like the acupressure mats and pillows and things. What is your is that similar? Is that a decent substitute?
It can help. I mean, anything you do at home is gonna help you. Whether you're meditating or listening to positive podcasts or whatever it may be, anything you do at home can help. So absolutely. I mean, you can buy anything on Amazon nowadays, right? So you can get those acupuncture ear seeds and Google and see, okay, it looks like it needs to go here. And basically you just put the ear seeds on, stimulate it, just press on it, and that can help. That can simulate the same relief of acupuncture with the needle. So if somebody is unable to access acupuncture, anything they can do at home is going to help. Just pressing on different acupressure points, using the ear seeds, and also meditating. Meditating is free, right? There's all these podcasts you can listen to for free. Books at the library. So anything you can do to help at home, absolutely.
And in the area of like like you said, very complex area of medication, I think the way I frame it to my clients, because sometimes it can feel like what comes first, the chicken or the egg? Like, do we need to do X, Y, and Z first before, they seek medication? Like sometimes they look to us to make that decision for them. And I'm like, listen, like we've said this whole entire podcast, your body. So it's completely up to you. Do you get like a fight or flight response immediately when you think about going and setting up that appointment or trying to take a medication? Okay, listen to that. Like it's okay to say, I'm not completely comfortable starting there.
Yeah.
Then we'll try some other things in this whole complex system that is the human experience. And then we'll see, because for some people, medication helps give their mind and body what it needs in order to be able to learn, be in the state to learn and apply skills and new tools and things. And for some people, it doesn't. It's not that way. So I think it does. It goes back to that listening to your body and just maybe taking inventory on the different areas and dimensions of life and say, which one of these feel like they are the most overwhelming or the things that are impacting me the most, and start there first. It's different for everybody, but I was curious about your perspective on like the at-home remedies or things that are accessible out there, as far as to the general public on Amazon and things. So but just that sounds like informing yourself, trying things and checking in with how you feel about it.
Yeah, and seeing what works for you. This acupuncture mat or whatever they have out there, it may work for one person, but it may not help another person. Just like any modality, there's no modality that helps 100% of people, but most things are going to be helpful for at least 80% of people. So you have to find what works for you. Absolutely.
Yeah. And I always say, don't give up on yourself. Like, just because you hear that this thing works for all these people and you go do it and maybe you don't have the same reaction, maybe just try it 1 or 2 more times.
Yeah.
Because that's helpful. And also don't then say, well, I tried and that didn't help, so I'm not worth the effort of seeking the right treatment for myself.
Yeah, that's right. Because there is so much out there now. With technology, there's so many good things about it. You can seek out so many different types of modalities. that you may not have in the past, like Reiki or energy healing, different things like that. So I agree, just be open to trying different things until you find something that works for you.
All right, this was awesome. I so appreciate having you on here. As always, you're welcome back anytime if you want to talk about another topic or go into depth on any of the ones we've discussed today. Before we close out, are there any last minute like closing things, anything you didn't get to share that you wanted to share, or a mantra or anything that you'd like to share with the audience? And then where can people find you?
Yeah, so basically the theme of the whole show is listen to your body. Know your own body, know what you require, but listen to your body. Only you know what your body needs, no one else. And you can find me on Facebook and Instagram at Conscious Wellness Ohio. And then also our website where you can find the different things we do is consciouswellness.janeapp.com. And then we also have another website, more informational, wellnessohio.net. So yeah, thank you guys so much for having me. This was a lot of fun.
I will definitely make sure I include all of that in the show notes. So again, thank you very much. We always appreciate anyone that takes their time to be with us, especially on Sunday, which is a day of rest for many. So thank you for just spending that with us. Next week, we are going to be, I think Ashley's a repeat guest. Maybe I wasn't here for that episode, right, Kels? Yeah. So Ashley Chambrello, she's coming to talk about how to be present with clients without your personal life getting in the way. Oof. That hits a little bit. I think if many of us that are working in the wellness profession aren't feeling some sort of way of trying to balance out life with practice, I don't know. Wow, that's going to be a great one. So make sure y'all subscribe so that you know when you're getting the next episodes, and we will see you next time. Take care.
Take care, everyone.
Bye.
Bye.